This will be about the recovery period of COVID-19 and the Swiss cheese model of intervention. The Swiss cheese model for the control of the pandemic, like COVID, was actually thought about when the pandemic started. So it is a model which emphasizes that no single intervention will actually work to control the layers of intervention that will stop the COVID virus from reaching a person. At our level as a person, we have what we call personal protective measures that we can do. For example, our social distancing, hand washing, wearing face mask and face shield, getting vaccinated. We can do all those measures as an individual. But there are also measures that are shared by the community. So for example, still providing proper information to everybody about COVID and what measures to do to prevent it. And there's of course the immunization or vaccination of more people, testing, proper immediate testing and surveillance. All these layers actually help reduce the transmission of the virus towards the individual. So however, if you can imagine the Swiss cheese model, some virus will get through some layers, right? Since our situation in the Philippines is we don't have that high a coverage of vaccination, or who have inadequate vaccination, or who still get infected with COVID despite vaccination, we need to add a layer of protection there for more severe disease. And I'd like to emphasize, therefore, that we need early treatment of COVID. So this is a layer of Swiss cheese that we really lack, but we urgently need. Because in our situation where the coverage of vaccination is not high, we will definitely get COVID infections still, and they can definitely deteriorate to severe despite some of the interventions we have in place. So when a person gets infected with COVID, there must be a tablet or an injection that can treat the illness itself, kill the virus that's in the body of the patient. And that will really stop transmission since the virus is dead and stop the deterioration of the patient to a more severe state. So emphasizing on early treatment, because we do have identified treatments for more severe COVID already. Now, however, these are treatments proven for severe or hospitalized patients. Now, what about those who have mild symptoms yet but are at risk for more severe COVID? So we should not wait for example, people who have diabetes or people who have heart disease and other illnesses. We should not wait for them to get to a severe state. So we should prevent that through early treatment. Once we have an identified early treatment that's affordable, that you can just drink at home and stop the infection in its tracks before it develops more damage in the body. There are several clinical trials going on. There are several candidates actually for early treatment, and there are a lot of promising ones. Since the jury isn't out yet about which ones really have most efficacy and safety in a large trial, so there is no recommendation yet for this early treatment that you can take at home. So just imagine, like, we do have early treatments and what we call post-exposure prophylaxis or prevention treatments for other infectious diseases. For example, if you're wading in the floodwaters, right, here in Metro Manila, there's a danger that the person will get leptospirosis. So actually, there is a post-exposure medication that people will take to prevent leptospirosis. That's one of the things that's possible in the future for COVID as well. And even for HIV, we do have medication after exposure to HIV. There's a medication that can kill the virus in your body while it's still in a small amount. So it's easy to handle yet. And then the full-blown disease will not develop anymore. So that same principle with early treatment. While the viral load has not actually, or the virus has not invaded, all parts of your body yet, we need to kill the virus. We need to protect our lungs, for example, and other organs from the damage caused by the COVID virus through early treatment. So same principle, when the oxygen saturation level of patient approaches really the low level, like 93% or lower, an early treatment for severe COVID can be done. But to really stop transmission, we really need to kill the virus inside the person's body so he will not transmit the virus to others anymore.
So most of these are under clinical trial?
Yes, but I really feel it's very promising, and soon we will have some results published, decisions made by health authorities regarding what really is an efficacious and safe early treatment for the population to take. And this is not going to undermine, the vaccination campaign. So like I mentioned about the Swiss cheese model, it's just adding a layer of intervention to reduce the risk of more severe disease and to reduce and to cut transmission of the infection. That's its purpose. People still need to get vaccinated because it does help reduce the risk of more severe COVID. We have been doing most of the interventions already, but we still lack the early treatment and the post-exposure prophylaxis. And I've learned this also from other infectious diseases that I work with. That's how infectious diseases are really approached. We have different criteria for saying that a patient is recovered from COVID. And of course, we base it mainly on the signs and symptoms of the patient rather than how long has the patient been sick. Okay? So first of all, the patient should not have had fever for like 3 straight days, no? And has not used any fever-reducing medication like paracetamol. So obviously, there's no more, that's a sign that the infection actually has cleared. And next is the other signs and symptoms like cough, colds, headache, are already recovery or gone, so totally resolved. When all the symptoms are gone, then surely we think that the patient has recovered. Those are really the basic signs and symptoms, and this is the same thing we would do for other infections. So no more fever, signs and symptoms are gone, or very, very minimal. So oftentimes COVID patients have this like dry, itchy throat, even after 2 weeks of having COVID. So they will keep on clearing their throat. Okay, when it's at this stage, it's actually acceptable, that they're considered cleared of COVID because it's just like a dryness. They're not actually coughing and they're on their way to recovery. The duration also of the illness, or how many days has the patient been ill, if it's a mild, what we consider a mild COVID case, that means their oxygen levels have never lowered below 93%. They're not overly weak or anything like that, no complications. The minimum isolation period can range from 10 days after the first day of symptom or after the first day of the RT-PCR testing. You count 10 days after that, and that's the end of your isolation period, or it could be extended to like 14 days because there may still be some remaining symptoms or signs. And by 14 days, studies have shown that the SARS-CoV-2 virus actually are most likely dead beyond 10 days of the COVID illness. And so if you have another swab test done from your nose and throat, it may be picking up the dead virus. This will still be positive even after you feel well and you're done with the 14 days of isolation. So don't be alarmed because it just might be picking up the dead virus remnants in your nose and your throat. However, if you had severe COVID or the patient had some immunocompromise, has a weak immune system to start with. For example, they were undergoing chemotherapy for cancer, or they were really on having a chronic, maybe autoimmune disease. So these are conditions wherein we would consider that the patient will really need a more prolonged isolation period because maybe the patient cannot clear the virus sooner than a healthy person. 21 days isolation period recommended for severe COVID cases or those who have weak immune systems. Don't be surprised if the isolation period is over 2 weeks. It's just playing safe also. Even if your signs and symptoms are relatively gone, after 2 weeks, we still give that extra week for you to fully recover, for the immune system to also, fully recover, and to make sure that you're not actually going to transmit the infection if you leave isolation already. The same things, no fever for 3 days, your signs and symptoms are gone or they're really very, very mild. Well, the
After that.
return to work depends also on how the patient feels. You know, COVID can really sap the energy of a patient. So the patient can feel really weak or they don't realize that they are still weak when they go back to work. Ideally, you still have to recover. Take like 1 more week off to really rest and recover from the COVID infection. Rather than say, oh, I'm done with isolation, I can go back to work right away. Some, of course, really do need to earn money. We understand that. But we advise them that please take it easy. Don't go straight into your hard work. There are still some damage in your body that COVID has caused, and you're not maybe fully recovered from yet. Much as how we would have to recover from a pneumonia, of other causes, or from infections or a flu. You cannot go straight back into work, or else we have what we call the relapse or the binat. We have a saying, oh, baka mabinat ka. No? So you might get sick again. And it can happen to some COVID patients. Then they realize when they get back to work that it's very tiring to walk, go upstairs, and to work for the usual amount of time that they used to work. I always advise patients, if you have your energy level back, so it's a matter of energy level, you're feeling strong, you don't get tired easily, then I think you can go back to work. Don't rush back into work because there are some cases, that really got sick again. They suddenly had complications that they didn't know they had from COVID. Actually, the re-swabbing is not actual requirement for those with mild COVID. It's really based, it's not a requirement to prove that one has recovered, having that negative PCR test. Well, the week after the isolation period is over and you seem to have recovered from the signs and symptoms, still have a checkup with your doctor. Report to your doctor, tell your energy level, or if there's still something lingering. For example, there's a lingering shortness of breath. Sometimes it happens with COVID pneumonia patients, and they still feel really weak. So the doctor will be able to advise more precautions, more measures so that you can recover well. I would advise the continuation of like the dietary supplements I mentioned earlier, like vitamin D or even the additional zinc or vitamin C. Keep them up because your body is still recovering from COVID. Rest and eating well. Patients ask us, please give me a request for the swab test to prove that I'm healed or I'm recovered. Recommendations of the Department of Health and even the World Health Organization, an employee doesn't have to show a negative swab test in order to prove that he's fully healed. But there are some offices or companies that require it. Just like to reassure people that you can be non-infectious even though the swab test shows a positive, result. Clinically or signs and symptoms wise, you're fully recovered. I guess it's just taking precautions, extra care. Person is really non-infectious. If the patient still has a slight cough, I don't actually tell them no. I mean, stay home. Still stay home, even if they feel all well. So you can still, droplets can still come out. Yes.
So I'd like to thank my sister, Dr. Belen Lardizabal-Dado.
Thank you, Noemi.
Yes, thank you. Thank you for taking care of me.
Oh,
I will
yes.
feature that in another video.
Oh,
Stay
yeah.
tuned for that episode.
Yes.